Welcome back to Mental Health Matters. We got a really incredible full house show for everybody today. And today's show, we have 3 guests in the room, 2 co-hosts, and a special guest. So we'll get to that in a second. You are listening to Mental Health Matters with Dr. Scott Terry. I am still Dr. Scott Terry, at least for this week. We'll see what happens next week. And I want to remind everybody these shows are broadcast Tuesday at 6:30 p.m., 12:30 at 12:30 if you are lucky enough to be living in the gracious place of Fairfield, Iowa. And if not, you could listen online. You could go to ardentcenter.com and pick up the shows there through the media channel. There's a lot of great ways to pick up the shows as podcast, as YouTube with videos underneath, which are really kind of fun. I highly recommend it. And stay in touch. Email us. Let us know what you think. We love when we get your emails. Touch base with us. Say what you'd like to have here and come on by. All right. So today we are delving into the realm of healthcare and the changes that have happened and didn't happen, and what is the implications for us all, as well as its relationships to mental health issues and to the wider world of what we're all wanting to create. So we're going to start with the masterful Nicole. Nicole, wonderful. Tell us who you are and why you're here.
Okay, I am Nicole Major, and I am here at Mental Health Matters, and I write for the Fairfield Ledger here in Fairfield, Iowa, and it's so great to be here today.
Hi, I'm Promila. I'm Dr. Promila Bahadur. I'm professor at Maharishi University. I teach computer science, but me and Nicole, we are concerned about health more today, so we are here.
Okay, and Ben.
Yeah, I'm Ben Pickard. I'm co-founder and president of Punctual Health, and we're a punctuality solution for healthcare.
Great. And what does that actually mean, punctuality health?
Well, 46% of Americans show up to their doctor's appointments on average 11 minutes late, and 10% don't show up at all. And so what that creates is just a lot of inefficiencies in the system. And that 10% no-show rate, that's just an average. So if everybody shows up on any given day, then everybody waits. And if no one does, then the doctor loses money. So we've created this very cool SaaS-based platform, basically built around a virtual waiting room that will allow a patient to, wait from the local Caribou Coffee, wait from their couch at home, and such, and really enhance their experience.
And that, it's really fascinating as we're going to get into this healthcare discussion to get this notion of what's behind the game that's being played in healthcare. Because all of us as consumers, we go to a doctor and okay, they're here, they've got to be rich and they've got to be making money off us. And I just have a problem. And why aren't they fixing my problem? Or I'm grateful that they did fix my problem, without getting the bigger picture of there's an industry to healthcare. And if the doctor can't do it in a way that works for them, they go out of business and then they can't help people. And it's, people are often complaining to me, oh, you're getting rich doing this. And it's like, really? Not in mental health, but not even in physical health, because it's not the same world as what your dad or grandfather or the other worlds that happen. And so these technologies really do make a difference so that doctors could be more efficient and become more productive, and they could serve clients better. But really understanding the whole gamut of this. It's like we had a show with other people, with Dr. Adam, and he was talking about, as a physical therapist. He's a doctor and physical therapist. And he was talking about, the other side of this coin as well. And, what does that actually mean? That people want to get better or don't want to, or insurance, and what is insurance and why does that cover and how does that cover? And this isn't all about making money, but finding a way where all of us can do what we're here to do so that the system works. Right. Okay. So, Ben, introduce to us the topic today and how this works.
Well, I'd like to really talk about healthcare on a global scale, and then dial it down to what we're facing in the United States in 2017.
Fantastic.
Here. So, really, the primary issue for any healthcare system is a moral one. If we want to fix American healthcare, we need to guarantee timely medical treatment to anyone who needs it, and right now we're just simply not doing that. Now, there's four main models of healthcare in this world. For the UK, most of Scandinavia, healthcare is provided as a public service funded by taxes, so basically no insurance is needed, and it's similar to the VA in the US. In Germany...
Except it's more functional than the VA. Yeah.
Absolutely.
I mean, some of the VA is absolutely wonderful if you have access to high-level services. Mm-hmm. For instance, if you've had a traumatic brain injury, being at Walter Reed is the top place in the world to get services. But if you're out in rural Iowa and you're needing services, sometimes some of the people, you could make it to Iowa City, and some places can be good, and some places are missing the point. But it's more uniform, like in the UK or in Scandinavia. I know in Australia and in Canada, mm-hmm. for instance, they have more of a socialist system that is also fairly productive, that produces health care at a much lower cost, doesn't give as much money to the last 6 months of life, where your quality of life goes nowhere to be improved, and stops wasting money on insurance companies and medicines that are several times the rate in the States. Actually, drugs are far more expensive for the same medication here than they are in some other place.
Absolutely. And the VA in particular has caught a lot of flack lately, where veterans are actually dying, waiting for their appointment to run around, or even dying like in the emergency room because of long wait time. So it's definitely got some room for improvement, that model here. Now, in Germany and Japan, health insurance plans, they're funded by employers and payroll deductions, so it's very similar to here, but those plans aren't allowed to make a profit. So essentially what you end up with is lower premiums in those countries. Now, in Canada, there is only one nationally run insurance plan that operates very much like Medicare here. And then finally, there's a lot of third world countries out there that pay for healthcare solely out of pocket, which is essentially what millions of uninsured Americans are up against. And I think it's around 25 million that would have been uninsured had this plan passed this past Friday. But regardless of the payer, the U.S. pays, to your point, Scott, more per capita per year for healthcare than any other country. And in the U.S., we pay...
With less better results.
Absolutely.
I've got to chime in here.
Yeah.
Why is that? That's something that I really just don't quite understand. Can you break that down for us, why we pay more here?
Yeah, absolutely. First, let's just quantify how much more, just to kind of frame it for the listeners here. In the U.S., we pay $9,000 per person for healthcare. In the U.K., they pay $3,000 US dollars per person. In Germany, $4,500. In Canada, $4,500. So yeah, the question really is, who in the U.S. is gaming the system and costing us 2 to 3 times as much per person on healthcare, while our infant mortality rate is higher, our average lifespan is shorter, etc. I mean, all of these major
and you think infant mortality rates, you think, no, that must be in rural war-torn Africa and the Sudan or something. But that's not the case. We actually have, in terms of the industrialized world, one of the highest infant mortality rates, and again, spend more. I think, to answer your question, again, we spend more in the last couple of years of life. Who's making, and it's an interesting thing that you're saying, Ben, follow the money. Mm-hmm. Where is the money going?
Yeah.
Well, the insurance companies are making a huge profit. The drug companies are making a lot of more money. Again, they're selling their drugs a lot more money. I can tell you as a provider and knowing many other providers in the system of providers, it's not that the providers are making out any better. In fact, they're making a huge amount less than they did in the past. In the past, I would have made a lot more money with my degrees and my doctorates and my way of function. I know medical providers would have made a lot more money.
Mm-hmm.
So where's the money going and where's it getting scammed? Not to say that some people aren't.
Sure.
But
Yeah, and you absolutely nailed it. There are three villains out there. It's the big insurance companies with the economic incentive to deny claims. It's the big pharmaceutical companies, which are basically acting as an oligopoly to set drug prices that are 60% higher in the U.S. than in other countries. And then it's even the big healthcare systems that are setting prices for standard medical procedures as much as 9 times higher than in other countries. And just a very quick aside and fast fact, 60% of personal bankruptcies in the U.S. are caused by healthcare bills, and that's simply not right. And then, finally, we can't really talk about, healthcare without talking about the political environment, and our politicians are essentially bought by these villains, and our political parties seemingly distracted over which gets credit for the right national solution, which at this point, after last Friday, the solution is clear. Universal health care, like in the UK, and if you do the math on it, taxes would increase by 3%, insurance premiums would absolutely go away, and each American would be $3,000 richer each year. And
we'd have better coverage.
Yeah.
Absolutely.
But it's
absolutely.
also, as a public health thing, what I think people forget, and I think, okay, if you think I'm rich, what do I care about poor people? Well, we don't live in a little island anymore. If I live with, let's say, poor people that I don't care about who aren't getting health care, do you think they don't get diseases and it's not spread in the air and the water and everything else? If I don't take care of those around me, it's not just being a good person or being a good whatever religion I want to say, Christian, Jew, Muslim, Hindu, right? It's not just being a good person.
Sure.
It's in my interest. That's the whole point when we talk about.
Scott, that reminds me that it's not about the rich or the poor. The point is what kind of world you want to give to your children, actually. And as you have just mentioned, diseases are something that can easily be communicated. So, and when just Ben was talking about the third world countries, I was thinking about India. I'm from India. I can just say very quickly, the good thing we have in India is that you have some federal hospitals. When you go there, you don't pay anything, absolutely nothing. Even if you are a poor person, you don't have zero, and if you have zero insurance, the federal government pays for your medicine bills. It gives you medicines free of cost and doctors available free of cost. Can you believe that, Nicole?
No, I can believe it. I can definitely.
I was just appreciating India for that. Thanks, dear.
Absolutely.
Yeah, and this might sound like an aside, but if you look at a country like France, they've got this very innovative little solution in addition to, some more nationalized type healthcare, and that's what they call a carte vitale, or a vitals card that's issued to every single citizen. That contains their personal medical histories that they can carry with them from doctor to doctor and basically hand the electronically chipped card to the doctors, and each visit it's going to be updated with their diagnosis, etc. And then the doctor scans it to receive an instant payment from the government for the services rendered, very much like what you were just describing in India there. Wow. So.
And again, France, even with, you think about French, the stereotype French people smoking and doing this. And they, again, much better health system at a much lower cost. And in fact, there's a lot of people in France, the doctors do much more house calls and things like, when's the last time you had a doctor do a house call?
Sure.
But again, the point is, what saves more money for what works for you and for everybody? Yeah, go.
I mean, I have a question for you. Actually, being a doctor, I wanted to ask you that just now Ben was mentioning about some pharmaceutical companies who are making big money.
Yeah.
So that was an issue in India also, and government has came up with they call it generic medicines. So what are these generic medicines? They contain the same composition of salts which these big companies are selling, but now they are selling the same composition of salts at a very, very cheap price, maybe 70-60% down that. So do we have some concept like that in US?
Well, there are generic medicines. And for instance, for my thyroid medicine, I get it generic from Walmart, and it cost $4 a month, as opposed to what I was spending originally, which was like $70 a month.
Okay, so
and it was crazy. Now, again, there are some issues with some people where the genetic recomposition doesn't work as well, but that's not always the case. And there's much bigger discussions that we could have someday about, is medicines useful for certain conditions? And we could certainly have those debates. For instance, in mental health, some of the medicines are not useful, but they're being pushed on people. The advertisements on TV, which again comes back to that same thing, that you should be taking basically antipsychotics or mood stabilizers for a depressive thing where it's not indicated, and so many things. Or you're feeling blue, well, maybe you're depressed and maybe you should take a medicine instead of dealing with what's really going on. So we could have those much larger discussions at some other point in a show, but the question is really about what works for you and what works for all of us, because we're all in this together to come up with a system that does work more effectively. And it certainly does work more globally. And I thank you so much, Ben, for showing us this. By the way, you're listening to Mental Health Matters with Dr. Scott Terry. Today we're talking about global issues of healthcare and how it relates to what didn't happen recently in Congress with ACH getting the repeal didn't go through, where 25 million people would have gotten kicked off of insurance, where the other ramifications where poor people would have basically had to spend a lot more. Rich people would have gotten a huge tax break. Older people would have spent several times more for their insurance. We could go, I'm sure Ben knows more of the statistics than I do about what would happen. But the point is, okay, it didn't go through. Let's try and come up with something else, but be informed. So go on, Ben. I'm sorry.
Oh, yeah. Absolutely.
By the way, KRUU 100.1 on your FM dial. Mental Health Matters. Okay. Thanks, Ben.
Yeah, I wanted to circle back to something you had said, like in your own personal practice, Scott. And, that was just about compensation and, being able to really make a living as a doctor. And if you look back 15 years ago, a doctor could make $300,000 per year. And, over the last 15 years, that slid down to basically $150,000 per year, which, still seems high to a lot of us. But what it's effectively done is made med school a bad investment. And all the time that you spent in school, like foregoing a salary and, a couple $100,000 or more in student debt, etc.
Right.
So basically,
and in mental health, how many, again, with a doctorate, and essentially most of the second doctorate and postdoc and 2 masters and on and on, how many years did I spend in school?
Sure.
How much more money? How much time didn't I make money doing this? And so when people start talking about, well, how much are you making? Well, I'm making a fraction of what I would have made years ago.
Sure.
But even now, even with that, the amount of paperwork is several times what it was. I've been doing this 24 years.
Sure.
And what it was years ago is, an absolute... So not only is it more time for less money, but everybody in the practices are being able to see people less, do less with what's there.
Yeah, so this paperwork and really, built
which
around
comes back
these
to your point
ICD.
again about being more efficient, which is why I so appreciate the company you're doing.
Sure. But, kind of the billing codes that a doctor in the United States has to go through, they just did a switch over from what they called ICD-9 to ICD-10 codes.
Yeah.
And ICD-9 codes, there were 13,000, specific ailments and such that one could bill for. And then I believe that went up to, pretty close to 50,000.
Yeah.
So it's just an administrative nightmare to even get the money from your patients. And, this lack of compensation for our doctors, we're taking our noblest class and really turning them into civil servants here. And that's not quite right. And what the U.S. is facing by year 2020 is a doctor shortage of 100,000. And that's on a denominator of only 600,000 practicing in the U.S. I mean, it's quite the crisis that we're approaching here.
Absolutely. As well as a crisis where the doctors who are in practice are trying to only be in specialties, so you start losing general practitioners. And so you start becoming less and less integrative in how you're treating somebody. Oh, you have something wrong with your stomach, see the gastroenterologist. Oh, no, it's something with your head. Okay, then go see a head person. No, it's this, and it's like nobody's treating the whole person and saying, okay, well, maybe this part of something you need a little help with, and this part. So sometimes, yes, specialties are absolutely vital, but it's having a balance, and that's what we come down to.
So my question is, we know that there are problems, obviously. Looking at what didn't go through, okay, they've obviously got to go back to the floor. They've got to figure something out. We look at these other countries. We look at socialized medicine. We look at everywhere else seems to have their head in the game. Okay, how does America do that? How do we go about dismantling everything that we've built to get something that's efficient and that helps people and that, in the meantime, saves us money as well?
Sure. Well, probably going to get a lot of winces from the listeners here, but Obamacare was fundamentally flawed and didn't address these structural issues that we're talking about now. I mean, there were Band-Aids and workarounds, and, it just didn't make business sense for a lot of the players involved in the industry. And now this repeal and replace proposal that failed on Friday, that was flawed for the exact same reason. It didn't get to these structural issues that...
You're saying it's all missing the point.
Absolutely.
So what's the real point of what needs to get done then?
What do we do?
You're saying go back to a single-payer system, as Bernie is suggesting, as many people have suggested, certainly more on the left, but I've heard calls on the right of people saying, you know what, we need a system that works for everybody because it is costing all of us more money to not have this fixed. When somebody who can't afford it ends up at the hospital, as opposed to going to their primary care, it costs all of us much more money to support that person.
Sure. Now, I'm genuinely not going to be surprised if over this next year, universal health care does become the Obamacare replacement. It's got tremendous Republican support. I believe that 40% of Republicans are on board. Obviously, tremendous Democratic support, and then independents as well, because that's the structural fix that we need to better guarantee, that we're delivering on this, what's really a moral issue, guaranteeing timely medical treatment to anyone who needs it.
So the question is, how do we get there? Is there any other history that we really need to do? I know we only have another 5 minutes here, but Ben, where else do we go with this now? Do we finish up with what else is going on in the world to learn the lessons of what could be done here, or where do you want to go with this?
Well, since the name of the program is Mental Health Matters, maybe let's just take a look at mental health and, do kind of a case study in this universal healthcare construct and see what it's actually going to do for people.
Okay.
Okay, so any given year, 25% of Americans experience a mental health disorder, and 50% of Americans experience a mental health disorder in their lifetime. And these figures are 20% higher than anywhere else in the world. So, I mean, granted, we've got a lot of luxury disorders here, first world problems and such, but there's a baseline of people desperately needing their help. And if you don't believe me, just ask their spouses. So 30,000 people commit suicide in the U.S. each year. So, yeah, that's our 11th leading cause of death. So we really need to start there. And only 40% of people with mental health disorders in the U.S. receive treatment. Now, circling way back to the U.K. And universal healthcare, and really these models with universal healthcare, the number of people receiving treatment that need it jumps up to 60%. 40% here, 60% with universal healthcare. And, you know, in the U.S., it's not really the lowest socioeconomic bracket that doesn't receive mental health care. I mean, the Medicaid folks and all. It's really that bracket one step up.
Yeah.
And those with the private insurance that may or may not cover certain drugs or disorder treatments. And that, you know, those same insurance plans might cap the number of mental health visits and all. So that's where the majority of Americans fall in this mental health system.
And that's what ACH or Obamacare, and they are the same things, if people seem to forget, as
Sure.
they have also stigmatized this bill. And the interesting thing is that even, you know, with what was going to be repealed, is mental health was going to be repealed, mental health parity. And, you know, again, the cost to society. And I think it's an interesting point you make about it's not the lowest of the low. Essentially, they're getting covered by Medicaid in the Medicaid expansion, which really made a difference as well. It wasn't just ACH. It was ACH and Medicaid expansion. But what I think was also interesting is that one tier up, as you're saying, which is what ACH was meant to cover. Yes, if you had money, you're on Blue Cross. It's the one level down where you can't afford the Blue Cross, but still need something to cover your butt so that you're not in trouble. Mm-hmm. Right? And having mental health parity is part of that, which is part of what the plan was intended. Right? So it wasn't just women's health care was also covered, or if you had a pre-existing condition, but also mental health issues were covered on ACH. And yes, it wasn't implemented as well as it could be, and it certainly was defunded. Actually, the Republicans defunded a lot of the things that they're complaining aren't in what they actually wanted. And so everybody's sort of playing games with this thing as opposed to actually trying to solve it. And I think the bigger issue is what can we do to support politicians to actually stop playing games with our health?
And solve the problem. Right. Absolutely.
See,
Oh, yeah, I'm totally with you. Let's solve the problem. I mean, obviously, if 25 million people are not going to have health care in 10 years, that's not solving the problem.
I think we should address this issue, and politicians should come above these political lines of parties and come think on this issue. This can be a major issue for anybody, actually.
Okay. So, Ben, what do you want to say to finish up?
Well, just on the mental health spectrum, the answer is exactly the same as for the healthcare system in general, and that's universal mental health care. And that's going to save and improve a lot of lives.
Excellent. Thank you, everybody, and I'm sure Ben will be with us for some more shows. So thank you, everyone, and have a
Thank
great
you.
day. Bye.
Bye-bye.
Bye.
Bye-bye.
Bye.
Bye-bye.
Bye.
Bye-bye.